Good afternoon, viewers. This is Professor Dr. Raheel Karim talking about depression, most common disorder, and I'm really glad that you are here with me today. My apologies for not being able to connect to you earlier because of work commitments. What is depression really? So Professor Paul Gilbert, in his book, Overcoming Depression, he emphasizes on the few things, and the key message that he gives is that depression is an extremely common disorder or a brain health problem which affects over 350 million people worldwide. It is the most commonly misunderstood illness. It can affect any human being regardless of their age, wealth, or background. And indeed, it can affect many species of animals too. Depression is basically a change in your brain state which pulls you into thinking and feeling depressed. It can be caused by many different things. Remember, again, one of the top tips, it's not your fault that you are depressed, and it is not a sign of human weakness or your particular weakness. It is very important not to blame yourself, as self-criticism in all studies that we have done is strongly linked to depression and can keep it going. Instead, what you can do is to find more about depression and practice techniques which will help you to shift your mind out of the depressed brain state. I certainly appreciate that this is easier said than done, but give it a go and see what really works for you as an individual. Causes of depression. So what causes depression? We know that there are many things that can cause depression as an illness, and often many factors can combine to cause depression. Some people are able to pinpoint a downward spiral of events that has led to their depression, such as relationship breakdown, leading to seeing less of friends and family, leading to drinking more, socially isolating yourself. We'll learn more about how our thoughts, behavior, and feelings influence each other. And later in the video, what we can do is to help you to identify the downward spiral that actually is the core of a depressed mood state. So some things that can contribute to depression can be identified, but you can think of your own contributing factors, and you can basically make a list and write them on a piece of paper. But commonly seen are stressful life events such as loss of relationships or bereavement, your own personality, if you are a very critical kind of a person. So self-criticism is a possible result of your genetic makeup or how your environment has shaped your personality. I have mentioned about the genetic contribution of depression, as I see depression in many members of the same family. Depression is quite importantly genetically determined. Other causes is that, especially in women when they give birth, there are hormonal changes, there are physical health changes, and comes with all that is the responsibility of managing a new life. Another very important factor, contributing factor to depression, is loneliness, and I shall talk in a separate video as to how loneliness can be converted into solitude, and a state of being alone can be turned into a productive mind state. So when people are depressed, they have a tendency to use alcohol and drugs. Whilst alcohol and drugs can initially help in the short term, but in the long term they can create more problems than they solve as they affect the biochemistry of the brain. Another contributing factor to or causation of depression is long-standing illness. In some patients, we see that head injury is another important cause of depression. So if you have these contributing factors and the symptoms that I will elicit later, it is then important to go and see your doctor. If you think you have depression, it is also important for the doctor and for yourself to know that depression may have many physical causes, such as poor thyroid functioning or in particular hypothyroidism. So I will not go into the many details, but to sum it up, genetic causes, physical health problems, and adverse life events are one of the commonest causes of the disease of depression. So really, what are the symptoms of depression? It is natural to feel sad or to feel down, often in response to a loss, an ending, or something that didn't go as well as you wanted in a major area of your life. For example, relationships or at work. For most of us, these feelings can generally subside with the passage of time, but are not the same as clinical depression. Most people who have difficult life adversities, they can kind of resolve it if they have a healthy brain, and then they can move on in life. But in a depressed brain, it is much harder to do the same. So the symptoms of depression can be quite complex, and they can vary from one person to another. Generally, if you experience low mood, which extends over a length of time, there is loss of enjoyment, and if there are more than 4 of the following signs that have been going on for some more than 2 weeks, that have caused you continuous distress, most importantly, if they start to affect your functioning of the brain, please do seek medical advice. These days, there's a stigma attached, mostly in the third world, but in the Western world, people seek help more quickly. So therefore, any person who can seek help quickly is likely to get better quickly. I will reiterate and I will emphasize, you must remember it's not your fault if you find yourself feeling depressed. And looking at this video is a great start to learning more as to how to feel better. I'll also emphasize that depression is a treatable illness. So there can be psychological symptoms, there can be physical health symptoms, and then there can be social symptoms of depression. So persistent low mood extending over a period of two weeks, which has started now to affect your functioning. Feeling worse in the morning in your mood, not wanting to start the day, getting better as the day would go on, and sometimes some patients feel relatively better towards the evening time. There is a potential that your appetite may reduce, or you might start to eat excessively. Weight loss is another sign of clinical depression. Lack of energy, interest, motivation, desire, things that you have previously enjoyed doing, all lose perspective, and then you cannot see the meaning of those pleasures that you have previously enjoyed. Disturbed sleep pattern, in particular in a clinically depressed brain, people may be able to go off to sleep, but they have a tendency of waking up maybe a couple of hours before their usual waking up time. And at this time, they have a barrage of negative thoughts and anxiety, mostly about the future and the problems that they are encountering at present. Attention and concentration span also decreases. Feeling hopeless and helpless, feeling irritable. Most patients come and tell me that they feel irritable and not depressed, or they feel anxious and not depressed. So anxiety is basically just the tip of the iceberg. You have negative thoughts which then spark a spiral of anxiety symptoms. But as far as the treatment is concerned, the difference between anxiety and depression is not particularly significant from a clinical perspective, and the treatment is really much the same. Types of depression. So depression has a certain threshold, really. What we can do is to start to explore what I call subclinical depression, that you may have a small number of symptoms, but not enough for a diagnosis of depressive disorder. Then there is mild depression, where there are enough symptoms for a diagnosis, but there is minor impact on daily life and functioning. Moderate depressive disorder, you have more symptoms present, but it has a significant impact on your daily functioning and your life. Major depression, also known as clinical depression or major depressive disorder, and has major effect on making or conducting daily activities of life almost impossible. Depression can be part of a wider disorder known as bipolar disorder or manic depressive psychosis. So manic depressive psychosis is that you have spikes of depression followed by cycles of high hypomania. So your mood waxes and wanes over a length of time. So this is what we call bipolar disorder. Now, some people are chronically and persistently depressed. This is also known as chronic dysthymia or chronic depression. And this sort of depression can actually last for years, sometimes even despite treatment. Postnatal depression sometimes happens after giving birth, and it is largely due to hormonal and physical changes and having to adapt to the responsibility of a new life. Another type of depressive disorder is what is known as SAD, which is the short version of a seasonal affective disorder, sometimes also known as winter depression. This sets in with the reduction in daylight. And finally, there's another category where there is severe depression with psychotic symptoms. This is when you have severe depression and also experience hallucinations, which as you could be hearing voices, you could be smelling odd things, or seeing fearful things, or tasting things that aren't there. In addition, you can have delusional thoughts, which are thoughts or beliefs that are likely to be untrue. These are essentially the symptoms of psychosis. A depressed brain is likely to have what we call nihilistic delusions, which essentially means that people give me examples like time is stopped, the world is not spinning around, I am dead, I am a ghost. How to manage depression? So depression is closely linked to the relationship you have with yourself. And I cannot emphasize more on this. Your thoughts, feelings, and behavior will all influence each other and how you feel and how it influences your depressed mood state. A good starting point is to understand what symptoms of depression you have and whether you can notice any particular thoughts, feelings, environments, or behavior around the time that you are feeling particularly depressed. So what you can do is use a symptom tracker, as I call it. This is generally suggested to be used over a period of 2 weeks to see whether any patterns or any symptoms emerge. You can document them in the form of a diary, and becoming aware of these symptoms, later on you can share this with your health professional if you wish. Alternatively, you don't have to show this to anyone. The most important thing is to start becoming more gently aware of what your symptoms are, so you can then put them in perspective. What are the top tips to manage depression? Depression, grow your self-awareness. Identify your symptoms. Connect more to yourself, and connecting more to others are both great ways to managing depression. Another most important top tip is that you are certainly not alone. As I've mentioned, there are millions and millions of people out there in this. The only reason we feel isolated is that we do not share our depressive experience with each other for fear of stigma and for being labeled as mad. The exhaustion funnel is another very important concept to absorb, and you probably see a diagram as part of this video that shows how depression can limit our functioning. Mary Asberg's exhaustion funnel shows the process that can follow when our mood goes down. The narrow part of the circle shows how our life can narrow as we do fewer of the activities we enjoy and have less and less energy and have to focus more on work and being basically what I call the survival mode. Now, being in the survival mode requires energy, and it depletes us of our resources much more. Again, critical to remember, one step at a time. The good thing is that there are steps we can take to reverse this spiral or prevent it from getting worse. So what can you do really to address this depressive or exhaustion funnel? So there are two kinds of activities. One is known as the nourishing activities and the other are the depleting activities. So when we find our range of activities diminishing as a result of depression, it can be helpful to review what activities are part of our lives at the moment and think about whether they nourish us or deplete us. A useful way of doing this can be to complete a diary of a typical day, writing down a list of activities you complete and writing, maybe put an N if it is not done and a D if it is done. We have to also focus positively on the nourishing activities which can help us to increase energy, things that help us to feel calm and centered, and things and activities that help us to lift our mood. So depleting activities really decreases energy and it lowers mood, it increases the stress levels and tension. So some may vary depending upon the situation, time of the day and who you are with, for example. So try writing your own common nourishing or depleting activities in your diary. Remember to associate yourself with positive people who have a potential of lifting your mood. One of the tips and a good way to plan balanced activities when this has been reduced due to depression can be thinking by the acronym BACE, B-A-C-E. So you might not be able to achieve balance each section perfectly each day, but when looking at your week, try to make sure that most days have a bit of each area. So B stands for body care, which is getting enough quality sleep, not too much and not too little. Eating healthily and regularly. Most importantly, exercising regularly. I understand that these may be a tall ask, and when there is lack of motivation, it is very difficult to motivate yourself to exercise regularly or to eat healthily. Having the necessary rest time, limit smoking, limit your caffeine intake, limit your alcohol and drugs intake. Also, look at what you have achieved during the day, which is the again second bit A of the acronym BACE. So make targets which are goals that are realistic and achievable for the day. Get small little things done around the house. Maybe if you're a student or not even a student, concentrate on your personal development, start to study or work a little bit, and again as part of your achievement, do exercise regularly. So C stands for connecting, really. It can really be easy to neglect. When people get depressed, they tend to isolate themselves. They feel detached from the world. They have no motivation or interest to connect to others. But very importantly, when we are feeling low in our mood, relationships can genuinely help. So small little things like messaging a friend, going to a support group, going for a cup of coffee, even saying hello to someone when walking past them. Enjoyment, one of the first things we can stop doing when we are depressed. So identify this. So this is the E of the BACE. Enjoyment usually can come from hobbies, playing sports, something at home, and something with others. I do believe that sport is very important. If you have a good friend that can drag you to the tennis court or to the golf course or to the volleyball or to the badminton club. Viewers, one of the most important causation of depression is our personality and how we perceive ourselves and how we think that the world perceives us, is self-criticism. So self-criticism is linked to depression. Self-criticism can play a large part in depression. Try the exercise later on to see whether you can find a way to gently support yourself when you are feeling self-critical. Best exercise is that you must imagine that you know someone who you care about is suffering from depression the same as you, and they've asked you for your help. So what are you likely to tell them? What do you think they need to hear from you that would help them? How do you think you could treat them that would help them? What do you think that you could say to them that would help them? What do you think you could do to help them? Now gently turn these thoughts towards helping yourself to be your own best friend, be on your own side, and gently support yourself. Trust yourself. You know yourself best. You're the best expert on yourself. So tell yourself what you would have told this other person who's depressed. Treatment of depression. Mindfulness for depression can be a helpful tool to support recovery. Essentially, mindfulness is being here and now and being in the present, really not thinking about the past nor the future. This is an important tool to conduct yourself on a daily basis at all times. It's like whatever food is in front of you, focus on that. Focus on the colors of the food, the texture, how it is presented, and be here and now enjoying the food. So mindfulness can help reduce the suffering of depression on several levels. The initial suffering, there is the resistance to acknowledging the suffering and the reaction to the suffering. Whilst I have emphasized on one aspect that you could practice every day to help prevent your depression and to improve your mood, but on a professional level, it is my very humble request, having done this for over 4 decades, that please seek help. Do not suffer alone. There are plenty of ways that we can help you with. Antidepressant medication is one of the largest industries in the world. They are the most misunderstood group of medication. People generally think that if you have taken an antidepressant, it's for a lifetime. That is certainly not the case. People generally think that antidepressants are addictive, they'll get hooked on to it. Nothing is further from the truth. If your depression is slightly severe and it is a strong genetic component, maybe a couple of years of treatment, and whilst you are getting better, what will really help is that your brain will acquire strength. Combined antidepressants with things like cognitive behavioral therapy, self-reflection, the tips that I've given you above will go a long way. Remember, depression has a mortality associated with it, and depression has a cost in terms of not being able to work, not being able to fulfill your relationships, not being able to fulfill your obligations, not being able to enjoy. So there is a lot of benefit in having your depression treated so you can lead a better life. So my prayer for you all that who are depressed or who have friends or family suffering from depression, that this is a message of hope, that it is, whilst being a very common disorder, it is a treatable disorder in most cases. So hopelessness is one of the most important things which has been identified in all the studies. So if you do feel hopeless and you feel that maybe perhaps life is not worth living, so this is a major indication and the most important indication for you to seek help. If you have any questions, I will be only too happy to assist. And if I can help all the people who are watching this video in some way or the other, I shall be glad to do so. Thank you very much for listening to what I had to say to you. Please do subscribe. I don't like saying this, but please do subscribe to our channel, as it enhances the richness of the portal, and it may help a loved one if you were to share this video with others. God bless, and I shall see you soon. Thank you very much.